Welcome back to MLT 240. We're going to be starting Unit 2 today. We're going to be starting the unit on helminths. Helminths is a general term meaning worms, and in this unit we're going to be covering nematodes, cestodes, and trematodes, but today's lecture will be divided up into two parts and we'll be focusing on our nematodes. Section 1 of the lecture is going to cover nematodes, as we mentioned before. They're also referred to as roundworms, and here you see an example of what a roundworm looks like on this slide. Nematodes are referred to as roundworms because they are round when you perform a cross-section or cut the worm in half, and you'll be able to see what that looks like or a visual of that on the next slide here in just a minute. The nematode class includes free-living and parasitic species that spend part of their life cycle dependent on one or more hosts. Nematodes are dioecious, meaning they have separate sexes. Males are usually smaller than females, and they have a curved or coiled posterior end with copulatory spicules or bursa, and these are usually used for attachment during copulation. Female nematodes can produce hundreds to millions of offspring, depending on the species. Nematodes usually have complex internal organ systems. They usually have complex nerve cords as well as well-developed digestive systems. So this is an example of a nematode or a roundworm. Here's your roundworm up here. This would be the head end, and you have the pharynx, intestines, uterus, ovaries, and this is where the cross section is taken. So this is the whole worm, and this is B, where the cross section is taken. So this is how we get or refer to it as a roundworm, because this cross section is round. And you see when you cut into it or do the cross section, you can see a cross section of all the organelles that are inside the worm. Some more general characteristics of our nematodes. Humans are the definitive host for nematodes for medical importance. Remember, definitive host means an organism that supports the adult or reproductive form of a parasite. Some modes of infection include ingestion of the egg or the larva, direct skin penetration by the larva, or transmission of the larva by insect bite. Usually the number of adult worms present are related to the number of eggs or larvae that are ingested. Something we need to be aware of is the worm burden. This is the number of parasites within an organism or host at a particular time. This can be of pathological consequence as related to the number of worms that the host is carrying. This can relate to the degree of sickness that a patient is experiencing. Half of the adult nematodes that are parasitic to humans reside in the intestinal tract. Others are found in various human tissues like the muscle, lymph nodes, and other places. Nematode pathogenesis rests with the migration of adults or larvae through tissues. They can pierce the walls of the intestine. They can suck blood or cause allergic reactions due to secreted substances by the nematode. Migrating adults are associated with eosinophilia, and you can see an example of some eosinophils in a blood sample over here in the bottom right-hand corner. Most infected persons or people will have a low worm burden and modest symptoms. So a lot of times people won't even know they're infected with a nematode because they're not showing any symptoms. Here's a really good diagram showing the life cycle of our nematode. We would start up here. This is showing it in animal species, but it's the same for humans. A lot of times we would pick up the egg or the nematode through the oral route, and then the worm would travel on down to the intestines, or it might migrate to other tissues, and that worm or nematode might need to be coughed up, or it might mature into the intestine, and then ultimately the egg would be of the nematode would be passed out into the feces, where it could infect another human or another animal. This is a list of the intestinal nematodes that we're going to learn about in this lecture. You have an image right there on the right hand side showing a lot of these, so you see an example. but we're going to be covering each one of these in detail on the coming slides. We're going to be covering Enterobius vermicularis, Trichuris trichura, Ascaris lumbricoides, Necator americanus, Encyclostoma duodenal, Strongyloides stercoralis, and Trichonella spiralis. One thing I want to mention really quickly is Necator americanus and Encyclostoma duodenal. Both of these are hookworms, so both of them are going to look here. So that's your example. Again, we're going to talk about these a little bit later on. So let's jump right in with our first intestinal nematode. We're going to talk about Enterobius vermicularis. This is also known as our pinworm or our seatworm, but most often you're just going to hear it referred to as a pinworm. In most cases, you'll have asymptomatic patients. It rarely can lead to serious lesions. You can have slight irritation in the intestinal mucosa in patients. Other symptoms that are associated with the female adult migration of the worm are to the perianal folds of the patient. You have severe perianal itching in patients, mild nausea and loss of sleep, and irritability. And you can see this is perianal folds, or example perianal folds in the worms that are coming out of those perianal folds. So let's talk about routes of possible infection for our pinworms. Eggs are deposited usually in the perianal folds. You can have self-infection that occurs by transferring eggs to the mouth from the hands if a patient has been scratching the perianal area. You can have person-to-person transmission that can occur through handling contaminated clothing or bedding. You can have enterobiasis infections. This is an infection of pinworms that may also be acquired through surfaces in the environment that are contaminated with the pinworms. Surfaces include carpeting, things like that, maybe even curtains. Some small eggs or number of eggs may become airborne or inhaled. These would be swallowed and follow the same development as ingested eggs. Following ingestion, the infected eggs, the larvae will hatch in the small intestine and the adults will establish themselves in the colon. The gravid females, gravid meaning pregnant or egg-carrying, females migrate nocturnally outside the anus and ovipost, lay their eggs while crawling on the skin of the perianal area. So around the outside of the anus area. So let's talk about distribution of Enterobius vermicularis. It has worldwide distribution, though more prevalent in our temperate climates. It is the most common helminth infection in the U.S. among children. Humans are the only known host. It can be self-limiting, meaning that it resolves on its own, but there are parasitic meds out there to treat a pinworm infection. Eggs are infected for several days. Eggs rarely are found in the fecal samples. We usually see the worms on the actual patient. Retro-infections or auto-infections are possible, meaning newly hatched larvae from the anus or the skin can crawl back into the rectum area and reinfect the patient. Here is an example of what the eggs of Enterobius vermicularis looks like, and it's very common for children to get pinworms from playing in a sandbox, because their bottoms are coming into contact with areas where other children's bottoms are coming into contact. And if one of those children have pinworms, they could very easily pass it to another child. Here's the life cycle for Enterobius vermicularis. Of course, you're going to be ingesting the egg. It's going to go down to the gut, and those worms or gravid females that lay the eggs are going to come out the anus or around the perianal folds at night, and that's where they're going to be passed on to other hosts, and that's how the life cycle continues. But if you look over here, this is showing the difference between the males and the females. You see that the male is quite a bit smaller, and plus he has kind of that curled tail, at the end, and the female is quite a bit larger. So lab ID of pinworms, we use the cellophane tape preparation or the Scotch tape method to usually diagnose patients. This is where we put tape on the bottom side, usually of the child or infant, if we think they have tapeworms, and we try to catch those worms coming out of those perianal folds at night. Again, they're usually going to come out at night, nocturnally. As far as the eggs themselves, that's what you're looking at here. This is not the worms, this is the eggs. The eggs have what's referred to as a green beret shape. They're not green in color, it's just the military green beret hat is what it said they'll resemble. They have a thick highland color of the shell, and it's supposedly, again, supposed to look like the little hat, a little beret. It's flattened on one side. And in some examples, you can possibly see the coiled up larva developing inside the egg. So here's a good view of what the egg looks like versus the female worm versus the male worm. Okay, the female worm is usually quite a bit larger, and she's going to have that uterus inside her because she's going to be egg carrying, and the male's going to be a little bit smaller, plus he's going to have that little curled up or spiral tail there on the end, and that supposedly helps him hold on during copulation. Our next intestinal nematode is Trichuris trichura. This one is our whipworm, is the common name. Light infections are usually asymptomatic and require no treatment. Heavy infections of 500 to 5,000 worms can cause ulcerative colitis in children. Ulcerative colitis is inflammation of the digestive tract, and IBD in adults. IBD is inflammatory bowel disease. Heavy infections can cause bloody or mucoid diarrhea, weight loss and weakness, abdominal pain and tenderness, also rectal prolapse, especially in children. Prolapse is when the rectum either bulges out or kind of falls out of the body. Infection usually occurs through ingestion of contaminated soil. And you see an image of what the egg for Trichuris trichura looks like over here in the bottom right corner. Okay, here's the life cycle for Trichuris trichura. The inbreeded egg is going to be ingested by the adult. It's going to go to the intestine. The unbreeded egg is going to be passed into the feces, and then the egg is going to mature out in the environment, likely out in the soil, before it's able to mature and be able to reinfect another human. And here are the difference between the male and the female, but I've got a little bit better picture coming up where you can see those differences a little bit better. So the uninbreeded egg is passed into the stool. In the soil, the eggs are going to develop into a 2-cell stage, an advanced cleavage stage. Then they're going to embryate or get to have an embryo at this point. Then the human host is going to ingest. So after ingestion, the eggs hatch in the small intestine, release the larvae that mature and establish themselves in the adult colon. The adult worms, which are about approximately 4 centimeters in length, live in the cecum and ascending colon. The cecum is a pouch that forms the first part of the large intestine. The adult worms are fixed in that location with the anterior portion threaded into the mucosa. The females begin to ovipost or lay their eggs 60 to 70 days after infection. Female worms in the cecum shed about 3,000 to 20,000 eggs per day. So here are our different stages for Trichuris trichura. Here's our egg, here's our larva, and here's our female worm, and here's our adult male worm. Again, our female is larger, our adult male is smaller, and again, the common name is the whipworm, and it's because of this long kind of whip tail they have on the end of the worm. Okay, what's the distribution for our whipworms? They're prevalent in warm climates and areas of poor sanitation in the U.S. It is prevalent in warm, humid climates in the South. It's the third most common helminth in the U.S. as far as infections. It's more common amongst children and the mentally disabled population. And eggs become infective in 15 to 30 days after being deposited in the soil. The lifespan of adult worms is about a year. A double infection is common with Ascaris, which is another roundworm. Pica is common in children. Pica is a term for chewing or putting things in your mouth, and we all know that children love to pick up and put things in their mouth. Mentally disabled patients, sometimes they suffer from a pica condition. It's something they cannot control. They pick up and put stuff in their mouth, so they're known to be a pica patient. Zoonosis can occur with whipworms. Humans can become infected with dog and pig whipworms. So how do we ID Tracheus trachea in the laboratory? We usually recover an ID in feces. We look for a barrel-shaped egg, and you can see examples over there on the right-hand side. You have two unstained clear polar plugs, and what it's referring to are these structures right here on the ends. These are your polar plugs, and you'll always have those at the end of your whipworm eggs. The size is anywhere from 50 to 54 microns by 22 to 23 microns. So they're kind of football shaped. The external layer of the shell of the egg is smooth and thick and usually a yellow-brown color. The egg is unembryated, meaning it does not have an embryo, at least not till the next stage. Its eggs are passed with stool. Here's a little bit better detailed image of Tracheus trachea. You have those two poles, you have an outer shell, you have an inner shell, you have that developing embryo, and it usually looks kind of grainy inside, but these are really good images of your whipworm eggs. Here's another example of what the adult whipworm looks like. This is a male, or example of a male. Next up for intestinal nematodes is Ascaris lumbicoides. This is known as the large intestinal roundworm. The transmission is through ingestion of contaminated soil, water, or food. You can have a tissue phase and an intestinal phase. In the tissue phase, with heavy or repeated infections, there can be a pneumonia in the patient, cough, or low-grade fever, eosinophilic, and allergic asthmatic reactions. In the intestinal phase, you might have intestinal or appendix obstructions resulting from migrating adults or heavy infections, vomiting, abdominal pain, again from adult migrating worms. You may have protein malnutrition that can occur in children, especially with heavy infections and poor diets. Also, you may have complications from the worms getting tangled or the migration of worms to other sites in the body. Here is the life cycle for Ascaris lumbicoides. Again, the human's gonna get infected by coming in contact with contaminated food or water or soil. Remember, you do have those two phases. You have the tissue phase that's going to affect places like the lungs, and you have the intestinal phase. But ultimately, the parasite's going to be passed through feces, and that's where the soil or food or whatever is going to become contaminated for the next human to be infected. The adult worms live in the lumen of the small intestine. The lumen is the opening of the small intestine. The females may produce approximately 250,000 eggs per day. So that's a lot of eggs, which can pass into the feces. Unfertilized eggs may be ingested, but not infective. After infected eggs are swallowed, the larvae hatch, invade the intestinal mucosa, and are carried via the portal vein, and then symptomatic circulation to the lungs. Remember, tissue phase. The larvae mature further in the lungs. This can take about 10 to 14 days. They penetrate the alveolar walls and ascend the bronchial tree to the throat and are swallowed. Upon reaching the small intestines after being swallowed, they develop into adult worms. And you can see some examples of the adult worms over here, and they're pretty good sized worms. As far as lab ID for Ascaris, we recover and identify the eggs in adult feces or the larvae in sputum. You can use the sedimentation method to recover, but you can use flotation, but the sedimentation is recommended over flotation because these are heavy and they tend to not want to float. And you can see an example of what Ascaris eggs look like down here. This particular example of eggs are fertilized eggs. On the next slide, we're going to see the difference between a fertilized Ascaris egg versus an unfertilized egg. Okay, both of these are examples of Ascaris lumbricoides eggs, but the one on the left side is fertilized. You can see the embryo inside versus the unfertilized egg on the right. So let's talk distribution for Ascaris lumbricoides. It's the largest adult intestinal nematode. It's the second most common intestinal helmet infection in the U.S. It's the most common worldwide. Female adults can lay up to 250,000 eggs per day. Eggs are infected in the soil for years, so they can lay dormant and still be infected, and they are resistant to most chemicals. And you can see the size, see how large they are over in this lab tech's hand over here. They're prevalent in warm countries and areas of poor sanitation, and in the U.S. they coexist really nicely with Trichuris ticura, which are found in the Appalachian Mountain region and adjacent regions to the east, south, and west. Just some additional notes for Ascaris is that adults or the adult worms are active migrators, and when provoked by for some reason like fever or certain drugs or even anesthesia, the worms will tangle and block the intestines or migrate through the intestines or the appendix and come out through the anus or the mouth. So if they get upset for some reason, they'll try to find a way out of the body. So you can see here an image of the large Ascaris worms blocking some intestines. And here you can see a patient where something, maybe this little boy had fever or whatever, but the worms are trying to escape. Fertile eggs embryoate and become infective after 18 days to several weeks. Between 2 to 3 months are required from ingestion for the effective eggs to ovipost by the adult female. Adult worms can live up to 1 to 2 years. So as long as they're in the host and they're happy, they can live up to 1 to 2 years as adult worms. This concludes part 1 of our nematode lecture. I will see you over in part 2 where we're going to continue talking about our intestinal nematodes.